Echo India, if you want to start moving people into the room.
Yeah, sure.
Okay, welcome everyone to session 4 of the Oxygen Therapy and Critical Care Case-Based Series. Today's topic is frequently asked questions, and our list of panelists are here for you on the screen. Leading the session is Professor Rwanda-Banguti from the University of Rwanda, and he is joined by Dr. Jackson Kwizera, Rumagiwa Liberata, Honorine Ingabire, and Francois Uwimana. Before we get started, we have a couple of housekeeping items to share with you. The first one is that our programming is based on a foundation of love and respect. Please respond kindly rather than react if you disagree with something that is said. It is everyone's responsibility to keep this webinar a safe space. We will be using the chat function for Q&A. The option to use this is at the bottom of your screen, so please send us all questions through the chat and feel free to introduce yourself. Please turn on your video, position your webcam effectively to show your face if alone, or to capture the whole group. If you are in a low bandwidth setting though, it might be easier for you to keep your video off to conserve your internet speed. If you have any IT issues, send us a message through the chat. And the session is being recorded and your attendance is consent to be recorded, so thank you. Finally, please be mindful of infection prevention and control. Try to limit the number of people joining from one gathering place and practice physical distancing. And so with that, I'll pass it off to Professor Banguti to explain a little bit more about how today's session will work.
Good afternoon, all friends and colleagues. Here we are again for another session, the fourth one. And as you remember, it was promised that after 4 sessions, we will give a certificate, and after giving a certificate, we will continue at a session for level 2. So today, it's the last session for level 1, and our idea is to prepare you for the test. There will be a small test. We will count your attendance, and we also will count your performance for the tests, and all of that we will share with you your certificate. So I hope you are all seeing my screen. It has been shared.
Yes, you're good.
Yeah, so it's frequently asked questions on oxygen series and critical care. So those are questions people have asked, and others in the history, it has been asked to many people. So we've taken some questions and went through the material on the Learning Resource Center and found some materials we've been discussing in the past 3 sessions. So we elaborate a number of questions which we will be discussing. So today it's more of discussion, interaction, and we request people to be as interactive as they can. And also call others who are not yet here to join, because it's a preparatory session. If you participate in this, you will be able to now take our tests, which is coming on 28th of April, which is next Wednesday. I think it will be around 3 p.m. We will just send to you the link. You will open, take your test for an hour, submit your questions, and leave the link. So the better you are prepared, the better you can score and get your certificate to continue level 2. So today we will have 3 stations. Station 1, you'll discuss question around indication for oxygen therapy. Station 2 will be escalation of care. There will be question discussed around escalation of care. And station 3 will be oxygen supply and delivery devices. So we will be rotating like this: A, B, C, D, or 1, 2, 3, 4, 1, 2, 3, and 1 again. So under the indication for oxygen therapy, you all remember that at the very first session, in the beginning, we discussed hypoxia, hypoxemia, definition, signs, when we start oxygen, and indication, contraindication for oxygen, titration of oxygen up and down. We introduced the pulse oximeter, the accuracy, the bias on a pulse oximeter, and duration and guidance for oxygen therapy. So those are the questions we will be discussing. It will be multiple choice question, and the leaders of the station will guide you how to answer and how to discuss. Then the second station on escalation of care, we'll discuss about RDS diagnosis and definition, when to escalate care, benefit of a wake-prone position. Those are things we'll learn in the past. And today, which will be just question and answers, and the indication for intubation and mechanical ventilation. Then station 3, that's where we'll discuss about non-invasive oxygen therapy, high-flow oxygen device, oxygen supply, oxygen safety, rebreathing carbon dioxide, and reusing of single-use equipment. So I know many centers now, we are in mentorship in some of these hospitals where you found people at the beginning have started with mask with reservoir, they've been throwing it away because it was single use. Now the hospital is empty, there is no more mask. So they could have started early enough to reuse and to clean and reuse. Today, patients could benefit, but because at the beginning, they were not informed about cleaning and reusing, today they are suffering. So we need to teach people and discuss how we can clean and reuse some of the items we can't easily find on the market, or we can't always get money or charge patient to pay for it. So from here, the guidance is that when we go into the breakout session, there will be a guide. It will be passing question by questions. Please be quick in answering so that we have enough time. 20 minutes for 15 questions. We need to be quick so that we discuss as many questions as we can. But the problem is not to finish, but to understand, so that when we come back after 1 hour, when we come back, we will wrap up and rediscuss again before closing the session. And after this session, next Wednesday, remember and tell others there is a test for whoever wants to get the certificate. There will be a small test, and you need to have above 75% on the test, and attendance on the session, 75% of attendance to get the certificate. So from here, welcome to the breakout sessions.
Professor Banguti, we have a question from Eric. I can let him unmute and then he can ask.
Yes, Eric.
Eric, go ahead. Or maybe it was a mistake. Eric, if you're having trouble unmuting, also feel free to put your question in the chat box. Okay.
I'm sorry, it was a mistake. I'm sorry.
Remember, there is a test next Wednesday, so be prepared for the test. Don't just take a snapshot or screenshot for the question so that you succeed. That is not good. So just exercise yourself.
Professor Banguti, there's a question about the test in the chat. Karine has asked, is it for everyone, the test next Wednesday?
Yeah, the test is for everyone. Whoever is willing to get a certificate for level 1 with 10 marks CPD, please take the test. Because it will be a certificate of learning and understanding, not a certificate of completion. There is no benefit of being attending on the screen and not being able to use a mask. We just want to see if people can use mask to put on their patient when they are sick. Those will be very easy questions, and you will see it today. So Alana, we can go for breakout sessions.
Okay, great. So before we go to the breakout sessions, I just wanted to share a couple of reminders. So each session will have a chair who will lead the discussion. Once you're in the breakout room, you're welcome to unmute yourself or to use the chat box to participate. As Professor Banguti described, we have 3 stations today. So you'll be having 3 different presenters cover a different topic for a total of 45 minutes. And each room will focus on a different topic. So we have indications for oxygen therapy, escalation of care, and oxygen therapy tools and devices. This note is for the panelists. When there's 2 minutes left, you will receive a reminder to wrap up. And sorry, the timing here needs to be updated, but each session will be 18 minutes, sorry, not 15 minutes. And so in just a minute, you will be moved into your breakout rooms to start.
Hello, team.
Hi.
Hi. Do you see the shared screen?
Yes.
Okay. Now we are going to see multiple questions on the indication of oxygen for oxygen therapy. We will have a slide for question, then after answering, we will give an answer. This is the first question. Which of the following are indication for oxygen therapy? A, B, C, D, E.
A and B, D.
Anyone with different answer? We need many answers. We need to hear from you answering. One said D. Okay, let us go to the answer. The answer is D. We go to the second question. Which one of the below assertions is not correct concerning hypoxemia? A, B, C, D. What is the answer? Hello team, I want to hear from you the answer.
No, C is correct.
Martine, don't you have an answer? Let me give you an answer. The answer is D. Let's go to the third question. Among below cases, which one is not indication of hyperbaric oxygen therapy? A, B, C, D, E. Hello, I want to hear from you the answer. We have 15 questions. You have to be quick.
Hyperbaric means high pressure. What does hyperbaric mean?
Yes, it's given under a high pressure.
When we say pressure, it can be pressure, partial pressure, not always pressure is a dynamic pressure. It can be high partial pressure of oxygen.
No idea for the answer?
Maybe C.
Thank you. Thank you very much. Okay, let us get the answer. The answer is D. Let us go to the fourth question. Below are complications related to oxygen therapy except one. A, B, C, D, E. We have to give an answer quickly. We remain with 11 questions. No idea.
B.
Wow. The answer is B. Let us go to the fifth question. Concerning hypoxia and hypoxemia, one of the below is not correct. A, B, C, D, E. No answer. Hello, team.
The answer is C.
Okay, let us check. The answer is C. Wow. I would like to hear your names while we want to answer, so I can memorize your names. Thank you. Let us go to the sixth one. Which of the following are not clinical signs and symptoms of hypoxemia? A, B, C, D.
C.
Thank you. What is your name? Hello?
Tamari.
Okay, Tamara, thank you. The answer is C. Let us go to the seventh one. One of below is not a clinical sign and symptom of hypoxemia in adults. A, B, C, D, E. Hello? No answer?
It's B.
Thank you, that's true. What is your name?
Olivier.
Thank you, Olivier. The answer is B. Anemia is not a sign or a symptom. One of the below is not a clinical sign symptom of hypoxemia in pediatric. Retractions, wheezing, trachea attack, head bobbing, stridor. What is the answer? A,
The answer
B.
is B.
A?
I think it's B.
D.
Yes.
C.
Yeah, thank you, all of you. The answer is C. C, it is a sign of severe respiratory distress in a pediatric patient, not a sign of hypoxemia in the pediatric environment. Let us go to the ninth one. At normal condition and room air, below are normal range of oxygen in the body except one. A, B, C, D, E. We will have discussion after finishing the questions if times allow. The answer is
D.
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 The answer is D. This should be a toxic oxygen. 10th question. In which of the following situations should supplement oxygen therapy be started? A, B, C, D, E. The answer is
E.
E. Repeat.
E.
Yeah. You are right. 11th one. About oxygen monitoring, below answers are correct except one. A, B, C, D. The answer is
C.
You are right. We go to 12th one. About oxygen titration up, one of the answer below is not correct. A, B, C, D. The answer is
D.
you are right. 13th question about oxygen titration down. One of the answers below is not correct. A, B, C, D. The answer is
D.
wow. Let us go to the 14th one. Below factors can interfere with pulse oximetry readings except one. A, B, C, D, E. The answer is
D.
really?
Which right, actually? The right of pulse oximeter or which right?
Ni kuvuga right of where the patient is.
Yeah,
I
D.
The
No,
answer is
E.
if we have like electricity power that is giving a yellow or bluish light, do you think it can't interfere with pulse oximetry?
The machine, the right where the patient is will interfere with the machine, with the pulse
The pulse
oximeter.
oximetry.
Really? I didn't know.
Okay, let us get an answer. The answer is C. We will have a discussion after the questions.
Dr. Rani, it's just a reminder, your time is up actually. You can move to another room if you may.
Okay.
Thank you.
How long should the oxygen be provided? This is the last one. How long should oxygen be provided to a patient? This is hypoxemic. A, B, C, D, E. This will be the answer. Thank you, team. Let us move to the other group. Which one of below assertions is not correct concerning hypoxemia? A, B, C, D.
Space D.
D is the
D must be
incorrect.
the answer. D.
The
D must
answer
be the answer.
Is the
D.
incorrect D.
The incorrect, the one that is not correct is D.
D, yes.
D is the incorrect.
Yes, thank you very much. Let us go to the third one. Among below cases, which one is not an indication of hyperbaric oxygen therapy? A, B, C, D, E. The answer is
D. D.
So this is like an introductory, which by these three answers, we go through the other questions and we have a complete and understandable answer on these devices we are using. So to be quick with the time, let me ask a question about which of the following is in the correct order for list FiO2 to the high delivered by these devices we are having. You will allow me to ask Uwase if she can help us or he can help us to answer this question. We are learning with the time, please try to be quick. Uwase? Marlene, can you help us to answer this question?
Marlene, I can see you say A. Can you explain?
Marlene? So most of them are answering A as the correct question. Vizir, can you help us to be more, to tell us why you choose A and not C?
I chose A because nasal prongs has the least FiO2 with only, it only gives 5, it only gives 20 to 40, 20 to 40 of FiO2 coming next, as it gives like 5 milliliters. And then comes the non-breather. And the simple mask comes next after the nasal prongs.
So you are right, you are correct, you are right. Actually,
I'm having problems getting there.
Yeah, you are okay. You are okay. Yeah. The upper maximum, the nasal prongs can give like if the nasal prongs is in 40s, whereas the simple masks can be in 60s. I mean the upper maximum, so that you can know from least to the higher, and then another breather can be in the 90s as the maximum. So the answer is correct. I'm trying to move to the next slide. There is a technical. I'm trying to share with you the next slide, but there is a technical problem. I don't know what's happening. Let me ask an assistance from Echo. So I can't move next slide. I don't know where it stops.
Check your connection and click into the next slide. Click into the next slide.
The correction, the network is no problem.
Okay.
So maybe I will use this method of, yeah. So the next question is about which device among the following use high flow system? So we are having 4 choices and one of them is true. Brigitte, can you help us to this question? Yes, Brigitte. Claude Nagy. Claude Nagy, can you help us please to answer this question?
Sorry. I have a technical issue. Sorry. Let me just read the question, then give the answer later. Which device among the following is used for high flow? Facial mask with a resolver bag, high flow. The A is the correct answer.
Can you explain why?
So the reason why facial mask with the resolver bag give high flow is just as we are just pushing on oxygen, the reservoir helps us to keep the oxygen over there while the system keeps giving the oxygen.
Why not C?
Nasal Cannula is not among the devices which can help us to give the high flow. It's just for low flow.
Okay. Have you ever seen it?
High flow nasal cannula, not yet.
Not yet.
Yeah.
I will show you tomorrow.
Thank you,
So I'm
sir.
asking you the question. So, Muhoza, can you help us to, are you with the Nagi, the answer is A, or is there something else? So there's, to this question, the answer is not A, is C, because we are talking about the high flow system. Claude, I know him is at Nyarugenge COVID Treatment Center. Because they are using the facial mask with the reservoir, when they are above 15 liters, they start to say we are having high flow oxygen. So that is high flow oxygen you are delivering by those low flow devices. But this high flow oxygen, high flow systems, it means another thing. High flow systems, a kind of fixed system. Whether the facial mask you are using there, they are variable ones. You cannot control them when you are above 15. But with this, the high flow nasal cannula, they are nasal cannula, but in their system, you can adjust according up to 60 liters you are having to get FiO2 you need. So the difference is after 15, for the facial mask you are having, even though you are saying you are having high flow, because you are giving above the normal, the standard one, at Nyarugenge, you are saying you are having high flow. You are having high flow oxygen, but you are not in the high flow system, which we will talk next in coming sessions. The next question is about true and false. Again, we are on those oxygen delivery devices. We are going to go one by one and answer to them. There is someone taking over Sparky too. Please, can you help us to tell if the question one is false or false or true? Mbabazi Jedia. Any comments? Any say on those questions?
It's true.
One is true. How is about to say two?
True.
How is about it two?
To me, it's false. Because normally nasal cannula delivers between 30 to 40%, but
so it's
very literatures. Thank you.
Yeah, it doesn't go above 40. Okay, is it false? Can you keep continuing and then you answer the three if it's false or true? Tired. Olivier Hasingizwe. Olivier. Please, I need you to be interactive to answer to this question and also fast because you don't have enough time to go through everything. If we are in this.
Yes.
Field. Yeah.
I'm around.
You are around. The sub question 3, is it true or false? Oxygen concentration.
It's true.
It's true.
It's true.
How's about the statement 4?
Come again.
The statement 4 is saying nasal dryness can be caused by the use of nasal cannula if the liter is above 3 liters per minute. If the flow is above 3 liters per minute.
I'm not sure on this.
No, it's not true.
It's not true. Why?
Because the nasal cannula has the capacity of delivering 2 to 6 liters per minute. Yeah, so three is the normal one, I think.
Normally, breeder mass can deliver between 50 and 70s. True or false?
False.
False. Joseline Lugema, can you help us? So, 4 is false, and the 5th is false, because here when we are talking about nasal dryness, this is the discussion we had when we are talking about humidification. Actually, the nasal cannula cannot cause a nasal dryness even though you are not using humidified oxygen, as we had seen them. This is the question we are, Dorothée, all the following are advantages of using a nasal cannula except. What is the correct answer? What is the disadvantages of using a nasal cannula among the 4? Vizir. Vizir.
The answer is D.
The answer is D. So you mean reusable of nasal cannula is the disadvantages of it? So here the
answer.
This is C.
Vizir is saying the answer is A. Dorothy is saying the answer is C. Dorothy, can you explain more?
That it is easily dislodged. Easily dislodged.
This is the disadvantage we have by using a nasal cannula. So easily, otherwise is
The
easy
answer
to
is
use.
C because it's easy to use, but it can be used when it is
Yeah, the answer is C.
I think the easily dislodged is a disadvantage, not an advantage.
Yeah, is it disadvantage as I was saying? Yes. It's not an advantage. Because you can put to the patient and then it's dislodged, you are not around, and when you turn, you are back. You understand what may happen.
How is the cost?
Yeah?
Cost.
The cost? The cost is low.
It's low.
Yeah, it's low cost. 4 liters. Discuss the next. A high flow classification of oxygen delivery devices is select one of the following. Vizir, can you continue talking while you are having your speech? Vizir? Martin,
which question?
This one. The other one was in the back we discussed. Choose the correct answer regarding the flow rate of the below oxygen delivery device. The correct answer is, you still have your speech. Vizir? Vizir? So you are free to use whichever language, Kinyarwanda, French, or English. Don't feel shy to use whichever in the three. Someone who is Spark 2, can you please help us to answer on this question? Olivier? Olivier, any idea?
The answer is E.
The answer is E. Can you tell us why?
The high flow nasal cannula. It is what you said in the previous slide.
Yes.
It has the high flow system
Francois,
where you can
you come back.
I'm always running after you.
As usual, it's your habit.
And I'm happy to join this very good group.
Thank you. Let me leave you, and then you be with it.
Yeah, sure.
Let me go somewhere else where you left.
Sure.
So you are talking about oxygen devices. So please stay with the group.
So you are delivering oxygen, right?
Good afternoon once again.
Good afternoon.
Good afternoon.
Thank you. So we are here to discuss different questions which were elaborated from the sessions we had in the last sessions. And the first question, to be quick, is asking about the source of oxygen. You remember the different source of oxygen, those we learned. And here is the list. I just need to hear from you. Which one is not a source of oxygen from the list? I'm waiting for your feedback. You remember about cylinders of different types?
D is not the source of oxygen.
D is not the source of oxygen. What about others? Yes?
They are.
Pardon?
They are the source of oxygen. The cylinders of different types. No, cylinders.
Others can be the source of oxygen, but the last one, not the source of oxygen.
Thank you so much. If we are helping people in first aid by blowing air mouth by mouth, that is not, our mouth are not the source of oxygen. We are just helping in emergency as a first aid. So from this list again, remember the oxygen supply devices. We have advantage of nasal cannula. From this list, which one is not an advantage of using a nasal cannula? From this
C.
C.
The answer is C.
Thank you so much. Thank you so much. This question came here because sometimes when a patient is desaturating, the nurses or doctors, they tend to increase the FiO2 or oxygen on the cylinders, but they forget that if the patient is using a nasal cannula, this can be easily dislodged, and you make a mistake knowing that a patient is being given an oxygen, and yet a nasal cannula has been dislodged. So this is an advantage and a disadvantage for using it, It's quite easy to be used. It's a low cost. It can be cleaned and be used. But the fact that it can be easily dislodged, it's a disadvantages for it. Thank you so much. This is the right answer. The next question. All the following are advantages of using a simple face mask, but there is one assertion which is not true. Others are true, but one is not correct. Which one?
C.
C?
No,
why
D.
do you choose C? Eh?
The answer is D. Sorry, D.
The answer is?
D.
D.
The answer is D.
Yeah.
Okay. Do you all know the meaning of that one?
Inappropriate for claustrophobic. Yeah.
Claustrophobic patients. Do you know who those patients are?
No, not well.
Not well.
No.
Not very well. Can you try? Can you try and tell us? Then we collect.
Claustrophobic patients are people who are afraid of being in enclosed places.
Yes, thank you so much. You see how the face mask is very close to the patient. So some patients who are claustrophobic, if you tend to use this face mask, they will keep having fear. They can even keep quiet, then you will find it having, like you can find they are becoming tachycardic, and yet they didn't come like that. So you have to know if the patient is claustrophobic, there is no need of using this device. You can choose another one which can help. Thank you so much. So now the next question is about the oxygen concentration. You remember we had different sources of oxygen, but some of them were used for concentrating oxygen. You remember that when we are extracting oxygen, it comes from atmospheric by being 21%. So for us to use it in the hospital at 100%, which device are used? Which equipment from the list are used for oxygen concentration? Is it A? Those cylinders, do they concentrate oxygen? Yes? Is it B?
No.
Is it B?
Yes.
No.
That one.
C?
Are we together?